Hello, viewers. You're welcome to our enlightenment program that seeks to enlighten you on issues that relate to your brain and spine health. My name is Dr. Bong Ekpene, a consultant neurosurgeon with the University of Uyo Teaching Hospital, Uyo in Akwa Ibom State, Nigeria, and a lecturer with the University of Uyo. In our previous videos, we have considered a very important symptom that occurs commonly, and that is headache. We looked at headache as being primary when there is no clear underlying cause, or secondary when there are clear underlying causes. In our previous videos, we considered some of the causes of secondary headache. We looked at several kinds of brain tumors, and we also considered head injury. And in our last video, we looked at chronic subdural hematoma as a cause of secondary headache. Today, we're looking at a very important cause of secondary headache, and very common too, and that is stroke. Stroke is a very serious medical emergency that accounts for a lot of death and disability worldwide. Stroke is said to occur when there is an interruption to the flow of blood to certain parts of the brain, resulting in brain cell death and resultant disabilities. It is called by different names. In Akwa Ibom State here, it is called Akbaoben, which means one side of the body is dead. It's also called Ekboamia, meaning that a spirit has struck the person. And that speaks to how serious this condition is considered. Some people spiritualize it, considering it to be a spiritual attack. But stroke is a medical condition, and it's an emergency that must be treated as such. Early diagnosis and treatment is very important, as that can save the brain and save life. And that is because when there is obstruction to blood flow to the brain, every minute that passes, over 2 million cells, brain cells, die. And that leads to worsening of the patient's condition. So time is of the essence. That is why it is commonly said that time is brain. So what is the burden of stroke? Stroke, the incidence of stroke worldwide is about 12 million every year. Annual incidence. 12 million people tend to be affected annually by stroke. And over 100 million people all over the world are living with various manifestations of stroke. It is the second commonest cause of death worldwide after ischemic heart disease. And it is stated that every 6 seconds, one person dies of stroke. And that translates to 10 people dying every minute. And that shows how important this particular condition called stroke is. Stroke can be divided into two. It can be either as a result of obstruction to the flow of blood in the vessel that leads to the brain, and that is called ischemic stroke, or there is a rupture of the blood vessels within the brain, causing bleeding into the brain. It's called hemorrhagic stroke. The ischemic stroke, which is what we are going to consider today, and in another video we will talk about the hemorrhagic type. The ischemic type usually occurs either as a narrowing of the blood vessel by blood clots, called the thrombotic type, or as a result of a dislodgement of a clot that occurred within blood vessels and are then transmitted through these blood vessels to the brain, where they can cause obstruction to blood flow and leading to stroke. It could also arise from the heart, when the heart have rhythm problem. So when stroke, ischemic stroke also has a subset which is called a transient ischemic attack, in which there is loss of function of the brain as a result of a temporary occlusion of the blood vessel that supplies the brain. And this usually resolves within 24 hours. The hemorrhagic type also can be divided into two. When there is a bleed into the brain tissue itself, that is called intracerebral hemorrhage. When the bleeding is into spaces around the brain, it is called subarachnoid hemorrhage. Today we are going to limit ourselves to just the ischemic stroke. And like I said earlier, we'll talk about hemorrhagic stroke in another video. So what are the risk factors for development of stroke? The risk factors can be divided into modifiable risk factors and the non-modifiable risk factors. The modifiable risk factors has to do with situations that you have control over, things that you have control over that you can manipulate to limit your risk of developing stroke. And these conditions include hypertension, diabetes, obesity, excessive cholesterol within the body called hyperlipidemia, smoking, excessive alcohol intake, drug abuse, especially drugs like cocaine, physical inactivity, not exercising, the type of diet one eats, which can predispose to other conditions that we've mentioned earlier. These are all modifiable risk factors, meaning that they are things that you can do something about. And that is the emphasis when we'll come to prevention. The non-modifiable risk factors are those ones that you don't have much control over. For instance, you can't do anything about your age because it is commoner with increasing age. You can't do something about your gender. It's commoner in males. You can't do something about your genetics. There is some genetic predisposition. Your parents had hypertension. There is a high tendency that you will have one if you don't do those things that are necessary to prevent you from having them. Even with that, the risk of developing hypertension or stroke is higher in that instance compared to those whose parents did not have hypertension. And there are other factors also which can be considered non-modifiable. So how does a patient who has stroke present? And this is very important that you pay attention at this very point in time. One of the first symptoms that a patient who develops stroke, ischemic stroke in this instance, would have is facial drooping. There's an acronym that is stated as FAST, F-A-S-T. F meaning facial drooping. One side of the face of the patient deviates or droops. If you ask a person to smile, the mouth deviates to one side and the face seems to droop to one side. You also would notice that the patient would have problems raising the hand. If you ask the person, raise your hand, that patient may not be able to raise the hand fully. That is the A, arm. The S, patient may have speech impairment, difficulty with speaking and understanding what is being said. And the T stands for time to call an emergency unit. Depending on which place you are, there may be emergency services, ambulance service available, which needs to be called because time is brain. Now, besides this acronym, there are other symptoms that the patient may present with. They may have headache in some instances, may also have problem with vision, have visual impairment either in one eye or both eyes. The patient may be confused. Sometimes the patient may even develop a seizure, convulsion. Patients may have overt weakness in one side of the body. the upper limb and the lower limb on one side. May also have numbness on one side of the body. Patients may have problem with balancing and walking. And these are all manifestations of a problem called ischemic stroke. When you see a patient who has this, it is not that a spirit struck the patient. It is not because of some spell cast on the person. It's the fact that there is obstruction to blood flow to the brain. And if that patient must survive and with no deficit, an emergency action must be taken. The patient must report at the hospital immediately. The fact is that there are medications that can be administered to the patient which can be life-saving and brain-saving. In the hospital, the patient will be examined for those symptoms and signs that we have mentioned, and the patient's brain will be scanned to decide whether it is actually a stroke, and if it is a stroke, if it is the bleeding type or the blockage of blood flow type, the ischemic in this instance, or the hemorrhagic type. If it is the ischemic type in which there's no bleed, then there's a drug that is called tissue plasminogen activator, which must be administered as soon as possible. Usually within 3 to 4.5 hours must be administered intravenously or intraarterially up to 6 hours. And if it's beyond 6 hours, then the patient will need to undergo interventional endoscopic retrieval of that clot called thrombectomy. And these are procedures that need to be done, and it's time bound. And if it is not done, that patient may lose the brain cells, and that will result in severe disability. Remember, we say time is brain, and every minute 2 million cells are going. That is why it's very important that if you identify a patient who has these symptoms that we've mentioned, it is not time to go to take a patient to the church, to a native doctor, to wherever. You must take that patient urgently to the hospital. That patient needs urgent attention. So how do you prevent stroke? The modifiable risk factors come into play here. You need to control your blood pressure as much as possible, because the commonest cause of stroke is poorly controlled hypertension or uncontrolled hypertension. Diabetes also is important to make sure that your blood sugar control is adequate. Maintain good weight. Maintain weights that are within normal range. Obesity, we know, is one of the causes of, or one of the risk factors for development of stroke. Ensure that your cholesterol level is controlled. Check it annually, or possibly if you have a higher risk for it, check it more frequently, like every 3 to 6 months. Check it and ensure that if it is high, that you are taking medications to keep it under control. For those who are hypertensive, ensure that you don't add salt to your diet. Ensure that the salt is within an acceptable limit, just to taste, because this itself can worsen hypertension, which increases the risk of developing this stroke that we are talking about. Also, smoking. There's no good in smoking. Smoking endangers your life. You must quit that habit. Excessive alcohol intake also is a high risk factor. You must kick that habit too. Physical inactivity, exercise is so important. Sedentary lifestyle can only predispose to conditions that would lead to a stroke. And in fact, it's stated that non-exercising lifestyle or sedentary lifestyle, sitting for a prolonged period of time, is now the new smoking. And smokers are liable to die young. So those who are sedentary, you're not helping yourself. Exercise as often as you can. And other risk factors that have been mentioned, you try to, as much as possible, try to prevent them as much as possible. So when stroke happens, it happens fast, and it must be treated fast for a good outcome. So I want to encourage you to share this video, like it, if you think it's useful, and also click on the notification button so that when other videos come out, you can be notified. And please, if you notice anybody who has any of these symptoms, no delays. Call the emergency number that you have on your screen here if you're in Akwa Ibom State, so that the Akwa Ibom State Emergency Medical Service, an ambulance system, can come pick the person up and take the person to the nearest hospital where life-saving measures can be done. Thank you. God bless.